Hi, my name is Dr. Atma and thank you for tuning in to one of my videos covering a very popular subject for patients that they might find confusing or embarrassing to talk about with their dentist. We all know that dentist appointments can sometimes be a little bit short or a little bit rushed, and sometimes you might not remember what your dentist or hygienist mentioned about brushing or flossing or any other things on oral hygiene. So in this video I'm going to be covering the very basics. So what we basically need is you either need a manual toothbrush or an electrical toothbrush, and either one is fine, but I do recommend an electrical toothbrush if you can, just because the research has shown that it does clean better, but something is better than nothing. So I'll be showing you today how to be using a manual toothbrush, and on this model what I'll be showing you is you want to make sure that the bristles of the toothbrush are going in between the teeth and between the margin of the gum and the tooth, and you just want to be using a very gentle round motion all the way along. You don't want to be scrubbing, because that's how you're going to cause irreversible damage to your teeth and to your gums and recession, which is something that's very difficult to reverse once it happens. So just very gently going all the way around on the outside, on the biting surfaces of your teeth, and on the insides as well, making sure that you hit every single spot as much as you can. So you want to spend about a minute on the top and a minute on the bottom in terms of brushing, twice a day, once in the morning and once in the evening. Now if you are using an electrical toothbrush, you don't need to do any motions, because the toothbrush will be doing everything for you. All you need to do is place your toothbrush with the bristles same 45-degree angle as the manual toothbrush, and just slowly move that around the outside surface, the biting surface, and on the inside, again for a minute at the top and a minute at the bottom as well. Make sure that regardless of whether or not you're using an electrical or a manual toothbrush, that you change your toothbrush head or the toothbrush itself every 3 to 4 months, as when they are soft they won't be cleaning as well anymore. Another subject to cover is interdental cleaning as well, and a lot of people are unsure about exactly how to use their floss. So what you want to do is use about 30 centimeters of the floss, as you can see. Wrap it around your fingers like so, and just do a forward, so an upward and a down motion as so, and moving along as you do each tooth. Sometimes you might have a bigger gap between your teeth, and your dentist or hygienist might recommend interdental brushes, in which case whichever brush they recommend to you, depending on the color, that will be the one that's most suited for use in between your teeth. And it's not uncommon to need different types of interdental brushes. With regards to what to use on your toothbrush when you're brushing, I do recommend using a fluoride toothpaste, as the research has shown that it is the fluoride that will help reverse early decay and also help prevent further decay from happening. Unfortunately, herbal toothpaste don't work as well, just because they don't have the fluoride in them. So thank you very much for tuning in to my video today, and if you enjoyed it, please hit the subscribe button below and have a nice day.